Hi, I am Sarah Ailey, the Principal Investigator for the Partnering with Persons with Intellectual and Developmental Disabilities PATH-PWIDD program. PATH-PWIDD is funded through a 5-year workforce development grant for closing the gap in health and healthcare for persons with intellectual and developmental disabilities. The healthcare system is ill-equipped to address the social determinants of health facing this population. On every level, from poor access to healthy communities, difficulties accessing health promotion and healthcare, and resultant high rates of chronic conditions and shorter life expectancies, persons with intellectual and developmental disabilities are very vulnerable to the systemic inequities in our healthcare system. During the 5 years of our funding, we intend to develop interprofessional practice and educational experiences for integration into the interprofessional education programs at our 5 core partner institutions and then disseminate to 30 additional institutions. We are guided by the collective impact model in this work. This model is based on the recognition that no single private or governmental body, no single policy nor set of stakeholders can solve entrenched social problems. Addressing such problems requires multi-sector ongoing collaboration and commitment with multimodal efforts. In the first year of our funding, having taken training in collective impact, we have established 3 action networks which collectively have over 50 members. The Communication Action Network takes responsibility in multimodal messaging about our work, including website, listserv, and social media messaging. Check out our website at path-pwidd.org. In the next couple of months, we plan to hire a content strategist to help with this effort, in part with additional funding from the Working for Inclusive and Transformative Healthcare Foundation. The Education, Practice, and Policy Action Network is taking responsibility for guiding development of community academic IPE partnerships. The Measurement, Evaluation, and Outcomes Action Network is implementing dynamic, ongoing evaluation of the program and has taken responsibility for our environmental scan of events, trends, relationships, expectations, opportunities, and threats connected to improving the health and healthcare of persons with intellectual and developmental disabilities. As part of our environmental scan, we are conducting a scoping review of the state of the practice of training and education of healthcare professionals and what has been accomplished since 1990 to develop, implement, and evaluate curricular training materials and practices for healthcare and social services students and professionals in practice to address the health and well-being of persons with intellectual and developmental disabilities. We have screened over 5,000 articles with 300 picked for full review. Obviously, this will be a major undertaking. We are using the socio-ecologic model to guide the review. This model includes the following 6 levels: individual, relationships, organizations, communities, policy, and society. The model is the underlying model for social determinants of health. We'll be categorizing content and outcomes objectives of curricular training materials according to the levels addressed. Changing the state of health for persons with intellectual and developmental disabilities requires that healthcare professionals get out of their individual silos, that we develop robust community academic partnerships for interprofessional practice and education, that we get out of the mode of healthcare education and practice with a predominant focus on clinical care and at the predominant level of provider-patient relationships, to addressing the broader organizational, community, policy, and societal levels that affect the health and well-being of populations. Thank you.